Hi, everyone. My name is Daniel Goldberg, and I am core faculty in the Center for Bioethics and Humanities at the University of Colorado's Anschutz Medical Campus. I am here to introduce the symposium issue in the Journal of Law, Medicine, and Ethics entitled Malingering and Health Policy. And I'm very excited to be able to help bring this symposium to the readers. In particular, I think, why does this matter? This symposium issue is actually the result of some years of thought and planning by myself and from several of the contributors, especially Stephen Casper. What we had noticed was that although there was a lot of good work in the history of medicine and science and technology and public health on the issue of malingering or anxieties about feigned illness, about people deceiving illness, there really wasn't a synthetic work that really got at the heart of what we were starting to believe, which is that these anxieties about feigned illness and about malingering are actually central to what passes for social policy and for health policy in most of the West, and especially in the United States. And what we really started to want to explore was the idea that you cannot really understand what the US is doing in terms of its health policies, both past and present and future, and perhaps more importantly, what the US has not been doing in terms of its social and health policies without really accounting for fears that people are feigning, faking illness and intentionally deceiving others. And so the papers in this symposium, the contributions here, really explore that issue and get at it and really tie past, present, and future in US health policy in particular to these sort of core issues of malingering. And my argument is that you cannot make sense of health policy in the US without really understanding the central role that these anxieties about malingering have played for centuries in the West in general, multiple centuries, and for the last few centuries, at least in the US in particular. So that's why this is important, is I don't really think that you can understand health policy or the health policies we don't have in the US without really accounting for and understanding the significance of anxieties about malingering and feigned illness. And that's what this symposium issue really is meant to show. It's also the result of a year-long working group from the Consortium for the History of Science, Technology, and Medicine, which is based in Philadelphia. We convened a working group, and then the contributions to this symposium issue came out of that working group. So we're really excited to be able to bring these to you, and I'd love to hear all the sort of feedback and conversation that ensues. Also very exciting is that this symposium issue is free, open access to everybody, which means there's no paywall for this one. And so we really, really hope that really sort of enhances the experience for everybody, and that people are able to really just sort of dive in and take a look and tell us what they think after engaging with these papers. So really excited that it's free and open access for everyone. And the easiest way to find these papers, of course, is to just do a good internet search for the Journal of Law, Medicine, and Ethics. You can search for symposium issue, and the title of the symposium issue, again, is Malingering and Health Policy. So thanks, everyone. Really hope to get as much engagement and reading and feedback and discussion as possible. And please feel free to contact myself or any of the authors if you'd like to engage further. Thanks so much.